I'm going to share the screen with you now. And let me know if you can see this, everybody. You can just give me a thumbs up if your microphones are off. So great. So I was trained as an occupational therapist, and Paul, do you have me pinned as the?
Yeah, so I have you're in a little box to the side of the screen.
All right, awesome. I'm an occupational therapist by trade, and as Paul told you, I've known him from when I was a case manager at the West Side Coalition for Older Adults. And I have been doing craniosacral therapy since 2012. I started because my son had migraines, and the doctor suggested that he try craniosacral therapy. And I took him in, and it worked really well for his migraines. And I was thinking, that doesn't look so hard. So just as I was kind of having this thought, I got a note in the mail saying, come get further educated in craniosacral therapy, and I need continuing education. So I went to the class, and after that I was completely hooked because it helped my daughter with her concussions. And for some of you who may have missed earlier, I have a neurological disease. It's called spinocerebellar ataxia, and this work has really helped me to keep myself healthy, and I get treated a lot. Now lately it's a hands-on therapy, and I have not been doing hands-on work since the pandemic. I've sort of switched. I do a lot of TAing and study groups, and I do those online, and mentoring. And I've done some distance healing, which is a different subject for another day. So what is craniosacral therapy? It's a gentle, hands-on method of evaluation and treatment that works with the body's nervous system to enhance your health. It facilitates your body's natural healing process using the least amount of force necessary to elicit a change in your tissues. I'm going to use the word therapist because when I refer to people who do craniosacral therapy, because they're typically massage therapists, occupational therapists, physical therapists, people who have a license that allows them to touch people in the state of Wisconsin. So your therapist uses about the amount of pressure of the weight of a nickel. That's our motto, the weight of a nickel. So that's really not a lot of pressure to put on the system, but we're trying to use the least amount necessary to elicit change. It's named for the bones that are at either end of the craniosacral system, which is the cranium and the sacrum. It focuses on the membrane that's the container for the fluid, the cerebral spinal fluid that bathes your brain and goes down all the way around your spinal cord. So this is just another view of that with the person laying down. There's your brain. It's this dark line it's called the dura, that holds in that fluid, cerebral spinal fluid, around your brain and bathes your spinal column. And so I like this picture because it really shows how we're working with a system that runs the whole length of the body. And how can it help you? Well, craniosacral therapy releases restrictions in the fascia. It balances the nervous system, and it brings nutrients to your brain and clears out toxins. So because of that, it's really great for pain relief with headaches, like even migraines, muscle soreness, fibromyalgia, any pain syndromes, nerve impingement, slip disc, bulging disc. I had one of my very first clients when I was learning this technique was a guy who was helping me with my air conditioner. And he was in so much pain. And I said, hey, you know, I just learned this technique. You want to try it sometime? And here's a guy, you know, has to carry these air conditioners all the time. He said, sure, I'll try it. He had surgery already on his low back and was planning for more surgery. And he took multiple pain medicines every morning. So I had him come in and I just did these basic techniques that I had learned in Craniosacral Therapy 1. And he said the next day he woke up and he didn't even realize that he didn't take his pain medicine until late in the morning, whereas usually he'd have trouble just even getting out of bed. So it really was startling to me being a new therapist, and startling to him because he'd been in pain for so many years. It really spoke to how this work can make significant changes for people. It also helps with concussions, whether they're recent concussions or old concussions. There's studies done with football players who've done intensive treatment and been able to improve on those post-concussive symptoms like foggy thinking, emotional lability or up and down with their emotions, and insomnia, memory. It can also help improve your breathing and digestion because it works with that fascia, and your fascia is the connective tissue that goes in between your muscles and onto your bones, and it helps loosen that up and allow it to move in the way that it wants to move. And maybe it's been pulled out of, there's a tension pattern, and craniosacral therapy will release that. And because of that, it improves your breathing, your digestion. I already mentioned foggy thinking and memory, reduces anxiety, and it improves your sleep. It moves fluids in your body, so it helps reduce swelling. It helps improve your immune response. It balances hormones, and then it just gives people an overall improvement in their vitality. So how does it work? It was developed through cranial osteopathy. So maybe some of you have an osteopath or a doctor, but the core belief in osteopathy is that the body functions as a dynamic unit, meaning it's very holistic. What affects one part of the body affects the whole body. And it also, there's this core belief that we have a self-regulating system which tends towards homeostasis, meaning our bodies are always working to go back or to be in a balance of all the systems, where we're getting enough oxygen, where we're getting rid of enough toxins, where we aren't having a buildup of any fluid. It's always reaching towards that goal of balance in every system in our bodies. So that's the same with the craniosacral system. And as craniosacral therapists, we're facilitating that, bringing the body into that homeostasis. We're primarily working with that fascia, the connective tissue between the muscles and the bones, and kind of using those parts of you, the skull, the bones of the skull, the bones of your body, and the muscles as a handle into that deeper tissue, that deeper membrane of the craniosacral system. And it balances the autonomic nervous system, that involuntary system of, you might be familiar with fight, flight, or freeze, or rest and digest. So because it balances that system, that's where it works on helping people relax, getting better sleep, those types of things, digest your food better. There are a few contraindications for craniosacral therapy, meaning if you have any of these, you cannot be seen by a craniosacral therapist until you've gotten an okay from your doctor. And that is if you've had a recent stroke or cerebral aneurysm, a recent skull fracture or serious head trauma with internal bleeding, or you have an epidural leak. Perhaps sometimes people get a shot or have fluid taken from the low back and for testing of something, and then sometimes that doesn't heal right away. So to make sure that that site is healed before you would get craniosacral therapy. And Arnold-Chiari malformation, which isn't that common, but common enough to mention it because it's where there's brain tissue that moves out of the skull. It's also helpful to let your therapist know if you have arthritis or other sensitivities in the neck, connective tissue disorders, or blood pressure issues. And that's simply because some techniques could exacerbate those or can be done differently, or will be done differently if you mention that you have these problems. So what would you expect when you go to a craniosacral therapist? First thing is they're going to want to review any important medical history. So if you, that's where you would say, well, you know, I have arthritis in my neck and it's very painful. And then the therapist would be able to jot that down. And if you had any of those things that the therapist thought maybe we need a doctor's okay for this, then that would be a time that he or she would discuss that with you. You remain fully clothed unless it's part of another massage treatment. All my clients, because I only do craniosacral therapy, remain fully clothed, and you get on the table in any position that's comfortable. I work on a massage table, and I have had clients who've come in and said they're not comfortable lying down. It makes them dizzy or for whatever reason, and I'm able to treat them sitting. I've also gone to nursing facilities and treated people in wheelchairs or in a hospital bed. So really, the position is, the main thing is that you are important, but you're also, it's important that you're comfortable. And a therapist can treat you in any position. Therapists treat children all the time, and you know, children do not stay still. They're often running around the office when you're treating them. So I really like to give my clients a lot of leeway in how they want to be so that they can enjoy the treatment. So first, the therapist does an evaluation, and that's, I'm just going to skip ahead because I want to show you a picture. So that's me with my daughter. They may cradle your head. They may have hands on top of your feet or at the pelvis. And this is true for the treatment phase too. It's a very gentle assessment that evaluates you at the feet, maybe at the thighs, at the pelvis, at the shoulders, and of course at the head, various hand positions. And the same with treatment. It should be, it's generally very gentle. Like I said, the weight of a nickel. And your therapist will be letting you know where they're going to put their hands. It's possible sometimes that you may come in with a headache, and after the evaluation, the therapist says, we're going to start at the pelvis. And that is simply because of that fascia, that connective tissue that runs all the way the whole length of your body. And when they may notice that there's some kind of a restriction at the pelvis that needs to be released first before we can work at the head. And or that you may even find that when that restriction at the pelvis is released, the head feels a lot better. So that's why don't be surprised that the treatment might start somewhere not where you're complaining about pain. It might be entirely across the body or seemingly unrelated. A couple things to mention when you go to get treated. It's good to not come right after a really big meal. So if you can avoid that, go plan at a time when you shouldn't go hungry, but not just have eaten a very heavy meal. And also it's always good to hydrate a lot beforehand, because this work does move toxins through and it's going to flush some toxins out. And that said, afterward, hydrate some more, because again, to flush those fluids out, you really want to be pumping the water, or maybe you like, you have some electrolyte drinks that you like. Sometimes people sit up from after treatment and they feel a little spacey or sometimes a little dizzy. And I really encourage people to just take their time sitting up, take a drink of water. Don't expect to jump up and run out until you've experienced the work a few times and you know how your body's going to react. It's best to not plan a big meeting afterward, like, ooh, I have to hurry up, get in my car and drive across town and be at another meeting where I have to think really clearly. Sometimes I would say, sometimes people do, they jump up and they feel great, but a lot of times it takes the body a little bit to integrate the treatment. So just don't be surprised. Or you may have come in with a headache in your back, the back of the head, and then you end up feeling it in the front of your head when you're leaving. And that's a change in symptoms. And we say that any change means that your body has taken the work and is integrating it and making a shift towards that homeostasis. If you had really if you went in with a headache and you're much worse, you need to let your craniosacral therapist know so that they can make an adjustment. But typically people feel great. They call me, they're like, I was so energized, or I slept really well that night. So you just want to make sure that you get a sense of what your body's going to feel like afterward before you start making plans directly after your treatment. And typically I have people come in once a week for a while, and then I spread it out to once a month, or once every 2 weeks, then once a month, then every 3 months. And I really leave it to, the way I work is I leave it to clients to help determine that. And also, I recommend always to do at least 3 sessions, because you won't know if it's going to impact whatever you're coming in for unless you've done it at least 3 times. Of course, after one time you might say, oh, I don't like how this works at all, or how it feels. And, that's okay too. You don't want to work with a person that you're not comfortable with, or do a treatment that you just don't feel good about, because that would defeat the purpose. But generally, if you think, oh, I just didn't really notice anything, then I would give it 2 or 3 times, and then you can have a better sense of whether it's going to work for your needs. And craniosacral therapy works really well as a standalone, but also with other treatments like acupuncture, massage, anything your doctor would. It's not going to contraindicate, or it's not going to going against anything that you might be doing, like physical therapy or that type of thing. And there are some techniques. Paul, how am I doing on time?
You, let's see, we started at 3:10. So you have another 10 minutes, 9 or 10 minutes.
Oh, super. I could speak slower. So there are some techniques that are self-care techniques that we can do to work with our craniosacral system, even if you can't feel feel into the system yourself. So in craniosacral therapy, we are sensing a rhythm in your body of the fluid that goes around the brain and down the spinal column. So that cerebral spinal fluid has a rhythm, just like your heart has a heart rate and breathing, your lungs have a respiratory rate. The movement of that fluid around the brain and down the spinal column have a rhythm. And every once in a while, that rhythm, there's a perceived pause or absence of the rhythm under our hands, and that's called a still point. And it's thought that, that happens naturally in the body throughout the day. And it's thought to be a moment of equilibrium between an inflow of cerebral spinal fluid and an outflow. And it can be induced. Your craniosacral system can be induced to have that moment of stillness and of quiet. And in that moment there happens to be a lot of work that gets done in the system of balancing that autonomic nervous system, that fight or flight, and the rest and digest. And also just releasing some of the little minor restrictions along the fascia, the connective tissue in the system. And you don't have to feel the rhythm in order to do these techniques. So they developed this still point inducer. That's one way you can do it, with this funny red two blobbed thing. And you could also tie 2 tennis balls together in a sock really tightly. But the key is to put it right. You can kind of see it on her pretty well, but at the top of the ear, aligned directly back to the back of the head. So the device goes top of the ear back to the, can you see me? I don't know. There. And you lay down on that for 15 minutes. I have this device for sale at my office, and with it comes some music and some more instructions. When I have clients that are interested in the still point, this is called the still point inducer, I try it out with them at the office so that they can know how it's supposed to feel behind their heads. And also I have them show me how they would use it so we know that it's in the right place. There's another way to do this, which is to, because of the way the body moves, a very subtle movement during this rhythm of the cerebral spinal fluid moving around the brain and the spinal column. You can also do this. This is me. These are my feet. And the idea is to turn your legs inward and then tie the feet together in a gentle way so that they stay in that internal rotation. That's that turning inward. And I used a scarf that I had at home and then laid down. If I wanted to, I could have put a pillow under my legs and then lay down for 5 to 10 minutes. And I tried it just to make sure that it works, and it works really well. It's very relaxing. So that's another way to do this. And then I thought we'd try to do a gentle technique on ourselves. And I think, let me see if, yeah, that's the end. So I'm going to stop the share because I want to see everybody. So this technique that I thought we'd all try, you don't have to feel this rhythm at all, but you just place your hands on your thighs like you saw in that picture. And I'm going to play some music for a minute. Oh, my phone, of course, I turned it off because of the ringer. So give me a minute. But really, if you remember from that photo, my hands are really just gently on my thighs, not pushing anywhere, just gently laying there. And then we're going to intend for an inward push. It's going to be like, they look like this. They look like they're in one place, but you're feeling like a slight intention of internal rotation and holding it there. We'll hold it for a minute. Is that just to see what that feels like? So don't push on yourself very hard. Remember the weight of a nickel. So
when you're talking about rotation, you're talking about the hands more than the legs?
Right. So let's say, I don't know, I don't have a good thing for my leg, but let's say this is my leg. My right, this side. Okay. So my hand is here and I'm going to intend to push it inward towards the middle, right? But we're not going to push that hard. We're going to push with a very gentle touch. So the weight of a nickel. So it's going to look like this. See, I just got a tiny bit of tension in my hand when I did that. It might feel a little bit more like this, but it's going to look like this. Just this gentle inward rotation at your thighs. All right. So I'm going to play. Does that, any questions about that? We'll push in like that and then just hold it for 1 minute. And I'm going to play music so that we can know when our minute is up. If everyone wants to get their hands on their thighs, I'll start our music. And again, we're going to just place, can you hear the music at all? Just settle in, let your hands gently rest on your thighs. Relax at the shoulders. Maybe take a few deep breaths into your hips. And then just have that intention of internally rotating or pushing inward toward the middle with both hands and holding. Just holding. Gentle holding in midline or towards the middle. And gently start wiggling your toes and your fingers and open your eyes. And we'll return to the room to greet each other. Hello. And I'm done with my presentation about craniosacral therapy. And again, I thank you so much for your time. All right.
Yeah, thanks, Candace.
I can hear my teenagers. I don't know if you guys can.
I heard a little.
Like, put my headset on so I don't hear my teenagers anymore, please.
So we want to open it up to questions, so you guys can unmute yourselves when you have a question. Go ahead, Marilyn.
I have a couple that I think just require short answers.
Yes.
Number one, and you may have said it and I missed it. So apologies ahead of time. About how long does a treatment take?
Oh, no, I meant to say that. Thank
And
you.
also, is this something that insurance covers?
Good questions. Thank you so much. I typically treat people for 60 minutes. I have had people who request longer, like 75 minutes. But I also have had people who come for 45 minutes after they've kind of established a routine. And I also say kind of spread out the treatments over time, depending, like if somebody has post-concussive syndrome, they might want to come every 3 days for a while and then spread it out to 1 week and 2 weeks, that sort of thing. And hang on one second. Okay. So, yeah. So what was the other part of that question?
Insurance.
Oh, yeah. So I'm an occupational therapist, and if I was in a clinic like some PTs and OTs are, they can do this work and charge for it. I work privately, and so I just have private pay because the paperwork is very complicated. So I wasn't really up for that. So
do some of the health plans, do you know if they have that as part of their team
I
of?
think Group Health Cooperative had craniosacral therapists on staff. Yeah.
Yeah.
And I think, I know that UW Health does not, because that's the system I'm in, and I haven't been able to find anybody to do that work. But some acupuncturists also do craniosacral therapy, and some chiropractors also do craniosacral therapy. So, yeah.
And you were showing, oh, go ahead, Marilyn.
I don't want to monopolize. You said you were taking classes, and I'm just curious what institution teaches the classes that you're subscribing.
Yeah, thank you. That's another thing I should really also mention is that I practice from the Upledger School of Craniosacral Therapy. Dr. Upledger was a doctor of osteopathy who developed this particular type of craniosacral therapy, but there are other schools, and I'm not as familiar with them, but it's called biodynamic craniosacral therapy, and I think they're all really terrific. I mean, they all have this basis in osteopathy, and it's just maybe a little bit slightly worded differently for each. I mean, I haven't gone to biodynamics, so I don't know. But I think when I've heard people speak, the heart is in the same place, and a lot of the basic theory is in the same place. So, yeah, thank you.
I have a sort of a question.
Yep.
But my question doesn't really have a good answer, I don't think. It's just when something is going on with a person, there are so many different modalities, and you might be a little frantic to get treatment, but should I do acupuncture, acupressure, massage. I mean, there's so many different choices. So
Yes.
just kind of go with what you've heard and who you have heard recommended, or you try. It's like once when I had a problem, I just did everything because I just wanted the problem to go away and I didn't know what to do.
Right. Right. And I think that's part of that process of when you are in an acute situation where something's really, um, you know, you're kind of at your wit's end and you really want help with something. A lot of people do that. Like they'll just, oh, I'm going to try this. I'm going to try that. I'm going to try that. And I would say, I get clients like that. And I've been like that because I have this neurological disease, and sometimes I'll be, you know, feeling like I really just, what can I do, you know? But so what I suggest to people is, you know, craniosacral therapy does enhance other treatments. So it can be used with other things. However, if you're wanting to see if it's really making a difference, you might want to like give it 3 weeks or something before you add another,
Right.
you know, add acupuncture or something. Or you might, I do have clients who say, okay, I'm getting acupuncture on Tuesday, so I'll see you on Thursday. And they seem to work nicely together or not. I mean, it's everybody kind of figures out their own system of what works and what doesn't work. But if you're really like in that phase of trying to figure out what works, you need to give it time to tell if that's making a difference versus something else. Like you'd have to sort of separate it out.
Yep.
Yeah.
That makes
and
sense.
I have had clients who like have just dramatically changed their diet, because that can help with a lot of inflammation, right? So people will go on certain kind of diet that helps reduce inflammation, and then they're not sure, is it the craniosacral therapy that's helping or the diet that's helping? And you know, the only way you know is if you stop one or the other. I mean, I've supported people through that process, because when you change your diet, you're getting rid of some toxins too, and your body is detoxing, and craniosacral therapy can help make that gentler. So you know, it really depends on your situation, but in my own personal regime, I include acupuncture, zero balancing, craniosacral therapy, and nutrition. So I've sort of figured out where those pieces all fit for me. And that's what I would encourage other people to do. Oh, and I do physical therapy. So where all those fit in.
Thank you.
Yeah, thanks for that question.
I have a couple of comments.
Yes.
I thought your presentation of the explanation of craniotherapy was well done. I thought your example slides were good in clarifying the medical terms like homeostasis and fascia, and explaining what those were, because not everybody understands what they are or what they do. I thought those were good points. The other issue I have is when you have somebody who has had one of the medical things that should get a referral for, how does that work? Does the doctor send you a letter? Do they send you an email? Do you bring a prescription? What is the usual routine for the exceptional patient?
Right. Great question. I ask, so let's say you had a recent stroke.
Right.
There are a number of ways to do that. Some people request a release of information, or like, allow me to speak to your doctor if you're not comfortable. But the main question is whether or not it's safe to have a very slight change in the pressure inside your cranium. It's a very slight change, but it's still a change, right? So if you're, you know, at risk for a bleed or further bleeding in your brain, we don't want to change the pressure even a little, So that's the main question. And so a person feels confident that they can get that information from their doctor as to when it's safe to be treated, then I would leave it to my client to figure that out. But I do know other therapists who will get a release of information and speak directly and kind of be at constant, in contact with the doctor so that they are on the same page about what's happening and whether it's safe.
How do you deal with people who have difficulty lying flat? I know several people who could participate in what you've described, but they have an exceeding amount of GERD or gastrointestinal reflux, and they have difficulty lying down flat for any extended period of time. Can you deal with that issue?
Yeah, so I would say I either treat people sitting up if it's really serious, like they just really can't lay down, or we can use pillows or wedges to prop people up. So when they're on the table, they're comfortable. People want a wedge under their legs or a bolster under their legs. Some people want a pillow under their head for GERD, or for if their neck hurts, they just can't lay flat on the table, then we maybe put a little pillow under their head. And I've had people who are in severe pain lay on their side because they're more comfortable on their side. So they may lay on their side and provide a pillow here and a pillow at their knees, or, depending. Most craniosacral therapists have lots of bolsters and pillows and things to help people get comfortable. So it's an issue. I mean, but I have treated lots of people sitting up, and I know other therapists who do that too. Thanks for that question.
I had a question about home treatment. You had the one thing with the balls in the back of your head. And I'm assuming that puts some pressure on that fluid there.
Yeah.
Is that right?
Right.
But so why would it be just that one spot? It would seem like you'd want to move that pressure stuff up and down your spine, or have some way to do that on your head. And I'm wondering, in these COVID times, is there a move to train people to do some of the stuff themselves?
Yeah, so that's the one technique we did, and I'd be really curious to hear about how that felt for you all to do that technique on your legs. The beautiful thing about these techniques are that it affects the entire system. So this one might be, if somebody had I'm trying to think of a good example. It's not coming to me, because I do know that if it affects the entire system. So anywhere you do it, whether it's on your thighs, on your shoulders, or on the back of your head, you're going to impact the entire craniosacral system, which goes from the skull all the way down to the sacrum. And so it doesn't really matter where you do that technique, but this one is thought to increase cerebral spinal fluid production because of where it sits on the head, because it's right behind, if you go here's your bone, and then we go forward into the brain, that's the cerebellum. We go forward from there, and you're at your fourth ventricle, which is a cistern of cerebrospinal fluid, and it's also where cerebrospinal fluid is produced. There's a system, there's a bunch of them, but anyway, it's one of the places that cerebrospinal fluid is produced. So it's thought that when you use this particular spot, you're impacting it right at the source of where it's being produced and encouraging more production. That's the theory. So that's why, and if you move it around in the wrong places, then you won't be right behind that fourth ventricle. And you might even be on a suture and sort of end up with a headache. So that's kind of want it to be, this one you really want to be in the right place. If your hands are on your thighs, it's not so critical, but yeah. Does that help?
Yeah, thanks.
Yeah. Yes, Marilyn.
Okay, you mentioned something about that this was part of an osteopath's training, the whole body. And so I would make the assumption then that doctors of osteopathy are familiar with this technique. But what about other medical folks who might make that recommendation for this type of treatment to their patients? Are they aware that there are possibilities with this kind of treatment?
There are some. I mean, like the doctor that referred my son who had migraines to a craniosacral therapist, she knew about it. And she also said it helps for people with digestive tract issues, which I've seen that help, like with IBS. And so some doctors are aware that it can help in cases. And I've gotten lots of, like I have, right now, it's just a little heartbreaking because I have not been treating people since March because of this. You're right there in people's faces or, in their space. So I do have friends who are treating people, but I don't feel comfortable because I have a disease that puts me at a high risk for the coronavirus. So I think, but when I was practicing, I was getting a lot of referrals from like 2 doctors who had come to see me as patients, and then they started referring. Or I had a client who was a part of, I want to say the headache clinic or something at UW. And all of a sudden I was getting all these referrals because she had told them, her doctor there, you should send people with headaches to Candace, and I would say there are so many craniosacral therapists you could go to. So if I'm busy or whatever, I have tons of referrals, but people I feel comfortable referring people to. But so that's how I got my business going. And I think that when doctors get feedback from their patients that say, hey, this really helped me with this thing, patients don't always understand why it helped, but curious doctors often will follow up and start making referrals. So it's not exactly something that's accepted as, there's lots if you Google it, there's a lot of things that say that, we can't believe that you can actually palpate the rhythm of the cerebral spinal fluid, but that's just going to be how it is. Some people are going to think that. So, yeah.
What do you think of inversion tables?
I think I actually haven't put a lot of thought into inversion tables, but that helps like lengthen the spine, right? Because,
right, it decompresses it. I mean, I have one and I initially used it. I was having a lot of lower back issues and sciatica, and they had one at the Y, and I had tried it, and then that seemed to help me. So, but I wondered if you had experience with people who've used those.
I have my stepmom uses one. She has scoliosis, and it's really helped her. It feels, I tried it. I was like, oh, that feels kind of good. I don't have any room in my house for one, but I could see how, especially if you have something where things are getting compressed, that it could be a way, if you can relax into it, to allow your spine to stretch out and give that membrane a nice stretch. But with anything, don't overdo it. Don't,
Right, right. And I also have herniated discs in my neck. And so I think that's helped. I don't do it that often, but it does seem to help.
Yeah. Yeah. I mean, if it helps and there doesn't seem to be any, I don't know of any major problems with those inversion tables, but like
I can
Yes?
think of there's a problem if a person tends to have vertigo, you don't want to go upside down.
Yes, if you do, yeah. Like, or
Yeah.
you have that orthostatic hypotension where your blood pressure drops when you come up.
Yeah.
That wouldn't be good, I guess.
Well, it's never really, completely upside down. It's almost more like a 45, 50 degree angle.
Mm-hmm.
And you're supposed to come up very slowly and just sit there for a minute before you get off.
Yeah.
Yep.
Well, thank you all. Does anybody else have any feedback about the presentation or the self-treatment or anything?
My only thing is just that you always have to have, it's good to have this extra time for questions, because there's always going to be something that you're kind of wondering about and, that you might not have thought about. So it's always good to have you here for that.
Yeah.
Mm-hmm.
Yeah. Great. Thank you.
Okay. Thank you.
Super. I really appreciate your time. Thank you, Paul.
Yeah, thank you, Candace, and good to see you. And if if anybody has any follow-up thing, I can pass that along, and Candace can, add that to the presentation or bring that back to her fellow learners there.
Okay.
Yes.
Yeah, and if you have any experience with it, let her know too.
Yeah, that would be great.
Yeah.
Good
Thank
luck
you.
to you.
Thank you.
Pardon,
Yeah,
thank
you.
you, Marilyn. Thank you.
Good to see you again.
All right.
Everybody
Bye.
be well.
Thank you. You too.
Bye.
Bye-bye. Thank you.